This segment sponsored by GBMC Healthcare.
You know, Christina and I were talking about this. This is a muscle that so many people are not really familiar with.
Right, including me. I'm not really sure exactly what the pelvic floor does, what its relation to health is, but we have good news for you. Yes, it does a lot. We're going to be talking about it today. Here to break it down for us and what you should look out for is GBMC's Dr. Joan Blomquist. Thank you so much for being with us.
Yeah.
Thanks for having me.
So tell us about this muscle.
So, well, the pelvic floor in general is support of the pelvic organs, so mostly the bladder, the uterus, the vagina, and the rectum. And there's connective tissue supports, but then there's also muscles that sort of act like a bowl to support all of those organs. So every time you stand up, those muscles have to engage so things stay where they're supposed to stay.
So it's
very
like
important.
here.
Right.
Yeah.
So it's kind of the support of your pelvic bones.
Oh, interesting.
Wow.
And is the health of your pelvic floor muscle related to your overall health?
Well, in general, if you have weak muscles other places, you might have weak muscles there too. But if that muscle is weak, sometimes you get uncomfortable feelings and leakage of urine, which might prevent you from exercising and doing things that are good for your health. So it's not so much that it's dangerous if that muscle is weak, it's just that it can make you uncomfortable and then not do healthy things for your overall health.
Gotcha.
Okay.
So talk to us about pelvic floor disorders.
So there are pelvic floor disorders include urinary incontinence, which is leakage of urine. Sometimes when you cough or sneeze, or sometimes if you get the urge to go and you can't quite get there in time. Anal incontinence is when you have loss of control of gas or stool. And then pelvic organ prolapse is a herniation or bulging of the vaginal walls or the uterus, either into the vagina or sometimes even outside of the vagina. That can be quite uncomfortable.
Gotcha. And some of those things you were describing sound like some of the things that I've heard women talk about after they have had some children. What is the relationship between childbirth and pelvic floor disorders?
Well, we definitely know a lot of previous studies have shown that these pelvic floor disorders are related to childbirth, so they're more common in women who've had vaginal deliveries and potentially bigger babies and longer labors and things like that. But there are other risk factors too. So, for example, obesity is a risk factor, and sometimes heavy lifting, constipation, genetics play a role.
Gotcha.
Oh, I see.
Is there anything that we can do to prevent these disorders from happening?
Well, that's kind of what this the study that I've been involved with recently was looking at. So, you know, we know in general that there are these risk factors, but the study that we did recently, which was a collaborative study between GBMC and Johns Hopkins, is that we were able to follow a large group of women over time so that we could study the impact of the mode of delivery as well as other risk factors on the development of pelvic floor disorders later in life. So the study involved 1,528 women, so this was a really big study, and we followed them over a 10-year time period.
Oh, wow.
And when they first came in for their first visit, we asked them questions about their childbirth. So, you know, how many pregnancies did they have, complications with the pregnancy, what was their labor like, how big was the baby, those kind of questions. And then we also had them complete questionnaires and did a physical exam so we could assess for the different pelvic floor disorders. And then we saw them every year. So we asked them to come back and we would repeat these questionnaires and repeat the exam so that we could see over time who is developing the pelvic floor disorders. And then that has allowed us to kind of identify some risk factors. And one of the hopes is that then if we know who's at high risk, then can we do some secondary prevention things to help prevent these disorders from happening.
Oh, gotcha. That's fascinating.
Definitely.
Yeah, I'm learning so much today. So talk to us a little bit more about the diagnosis and treatment of some of the conditions that you identified. Is it very complicated?
Well, for some people it can be quite simple. So for example, if part of the reason you're having a lot of urgency and need to run to the bathroom is because you're drinking 5 cups of coffee a day, then we can do some behavioral things and cut back on the coffee. And for a lot of people, it really is that simple.
Oh, wow.
But if you've got significant pelvic organ prolapse where the uterus is really coming outside of the vagina, then it can kind of be a complicated surgery sometimes to fix that. So there's all sorts of variations from behavioral things to pretty involved surgical repairs.
Is there any like lifestyle changes that we can do?
Well, so one of the things that we think might be helpful is doing pelvic exercises. So keeping those muscles strong. You've probably heard of the Kegel exercise, which is where you squeeze to try and prevent yourself from leaking urine, and that strengthens the muscle, and we think that can be effective. The other thing is being careful about what you eat and drink, because that can have an impact on the bladder function. Obesity has an impact, and so being careful about not getting overweight because that puts more pressure on the pelvic floor. Gotcha. And then, one of the things that we looked at this study was how does mode of delivery impact things, and not that we want to tell people how to have their babies, because there's a lot of other things that come into the decision as to how you deliver a baby. But for example, we found that women who have an operative vaginal delivery, which is when you have to use forceps or vacuum to help the baby to come out, that they're at the highest risk for developing all these pelvic floor disorders. And then women who had all their children by C-section are at the lowest risk. So if we know that someone needed to have an operative vaginal delivery, then we might say, okay, you're at higher risk, let's make sure you're doing the exercises, let's really watch your weight, let's do all of these preventive things because they're at higher risk for developing the pelvic floor disorders later in life.
Gotcha. So some interesting future applications as well, and not just childbirth related either.
Right, exactly.
That's fascinating. So is there somewhere that we can go if we're interested, maybe we're experiencing some of these symptoms ourselves, where we can learn more?
So there's a website called Voices for PFD, so Voices for Pelvic Floor Disorders, and that is sponsored by the American Urogyne Society, which is our national organization, and that's a patient website which has a lot of really good information on what the different disorders are and what are the conservative things that can be done versus the more involved treatments. And then also on our GBMC website under urogynecology, we have sort of a review of all this stuff also.
That's wonderful.
Thank you so much, Doctor.
Sure.
This conversation was definitely needed. I learned a lot as well.
I did as well, and hopefully you guys did too. So take your health into your own hands.
Absolutely.
Thank you so much for being with us.
Sure, thank you.
Always a pleasure.